Most people are not self-aware of their bad breath. Hint, if when you're talking to somebody face to face and they're pulling away, or you've been told by a significant other that your breath smells, guess what? You got to do something about it. You need to pay attention to the following. The treatment to eradicating bad breath is like peeling away layers of an onion. Can you appreciate the analogy? There could be multiple simultaneous sources for your bad breath. In general, there are 3 sources for your bad breath: oral cavity, nasal cavity, or your stomach area. Let's tackle the oral cavity. The mouth is responsible for 80% of your bad breath problems. Essentially, halitosis, bad breath, is the gas that you're smelling from the bacteria that's hanging out in your mouth. We're talking massive bacterial colonies just festering, producing gas. This gas is called volatile sulfur compounds. You're smelling bacterial gas. That's what bad breath is. In the mouth, we're talking possibly periodontal disease. Periodontal disease is a bacterial infection of your gums, resulting in loss of bone that supports your teeth. This is a bacterial infection that is aggressive and is just not good. Treatment of periodontal disease involves usually scaling and root planing, sometimes surgical intervention. The key is eliminate the bacteria, but once the bacteria is minimized, the bad breath should resolve. Poor dental hygiene. Well, you just don't pick up a toothbrush. You're going to have food trapped in your mouth. You can still have bad breath. So you need to brush. You need to floss. Dental cavities. It's a different type of bacteria that causes periodontal disease, but it's still bacteria. If you've got a lot of cavities, you got to get those fixed. It's real simple. You got to see me. Tobacco products. Well, tobacco smells. It's going to be in your mouth. The smell of tobacco is going to emanate. It's bad. Dental infections. Sometimes you can have a dental infection, not even realize it. It can be just festering and it's draining and it's a source of bad breath. That needs to be addressed as well. You see me for that. Dry mouth, xerostomia, same thing. I actually talked about this in my previous written blog, as well as video blog. When your mouth is dry, that means there's less saliva. Saliva is what washes off the bacteria from your teeth in your mouth. So therefore, you minimize the concentration of bacterial colonies that are just festering in your mouth when you have saliva. When you have no saliva, just the opposite is true. Dry mouth means that bacteria are increasing production, and as a result, they're going to have more byproduct, which is gas. This is what you're going to smell. Your partner's going to smell that. Certain foods, let's keep it real. Garlic, onion, not good. Tasty, but not good. The second common source for bad breath is the nasal cavity. You could have a sinus infection, post-nasal drip, allergies, anything that prevents the body from clearing bacteria in the sinus, lead to higher concentrations of bacteria in the sinus. Hence, you're going to have smelly gas that's emanating from the sinus. The third most popular and the last is from the GI, from the stomach. Acid reflux. GERD. All this will create an acid backflow into your mouth, and that smells. Besides, the implications of having acid sitting on your teeth is not good as well. Vitamin supplements. Some vitamin supplements will give you also regurg. Some medications that contain nitrate, that can give you bad breath. Those of you who are on a high protein, low carb diet, you're going to have bad breath. It has to do with the metabolism of fat in your body, and the breakdown of that fat results in what's called ketone bodies. Ketone bodies smell. Okay, once we've identified a source or these sources, we can then treat accordingly. By far, the mouth is the greatest offender source of bad breath, and in particular, the tongue. Incidentally, there's a huge number of bacterial colonies that love your tongue. The surface of the tongue has microscopic hairs. These hairs are notorious for trapped bacterial colonies. These bacterial colonies need to be removed. Therefore, we need to get rid of that. How do we get rid of that, you ask? Tongue scraper. Simple little tool. So once you brush, you take a little device, tongue scraper, and just scrape your tongue once or twice, maybe 3 times in the same direction. It's a real easy thing to do. It just requires a little time, like anything. Brush, floss, scrape, and to finish it off, you may want to reach for a little mouthwash. Now, with the mouthwash, you want to use an alcohol-free mouthwash. Alcohol-free because alcohol is an astringent. An astringent is something that dries your mouth out. Remember, I mentioned earlier, dry mouth will create bad breath. Therefore, no alcohol in your mouthwash. I'm only getting you ready for Valentine's Day, and you can thank me on February 15th. If you have enjoyed this video, please subscribe. It'll motivate me to do more. Sign up for my blog, robertemilioDDSblog.wordpress.com. You can follow me on Instagram, dentist_in_Connecticut. Get a peek in my inside life with my family, my kids, what I like to do, enjoy. Food, big foodie. Follow me on Facebook, Robert Emilio, DDS, and Associates. And you must hit subscribe. Bye.